Assessment 2, Presentation by Emma Braun. This case looks at Claire, aged 30, living with her parents and sisters. Claire reports feeling emotionally isolated and struggles to express her own point of view. She reports putting up a wall and stating she is fine, however uses this as a facade to hide deeper feelings of emotional pain, turmoil and isolation. Claire reports feeling ambivalent towards her decision to continue to live. In regards to relationships and support network, Claire reports a relationship with her parents which is affected by her father being verbally abusive and volatile, and her mother having high expectations with a tendency to be emotionally dismissive. Claire reports a close relationship with one of her sisters, though struggles with her sister's opinionated views on how Claire should manage problems. Her sister has encouraged Claire to attend therapy. However, Claire feels that her sister is more concerned with Claire's problems creating issues for others. Claire reports few friends and social supports, and she has not shared any of her current worries or concerns with them. Claire reports a prior suicide attempt, in which she experienced intense feelings of failure and she sat on the train tracks. Claire did not follow through this attempt due to concerns about the effect her actions would have on the train driver and witnesses. This experience led Claire to seek professional help. Claire has not disclosed this event to family or friends. When discussing a suicide plan, Claire verbalises a current suicide plan as jumping off a high bridge over water. She has indicated this decision is due to a wish to not impact others' innocent lives. Claire does not identify a particular bridge, but says it could happen as soon as tonight. Claire voices a wish to not be found if she did suicide and would prefer a non-painful method. On initial introductions to this case, Claire presents as a client that was at a high risk of suicide or self-harm. This initial reflection was informed by a number of aspects. Firstly, Claire reporting problematic relationships with her family, which are shown to be linked with higher levels of depression. Secondly, her reported feelings of isolation, great emotional pain, and ambivalence towards continuing to live. Finally, the prior suicide attempt indicates a greater risk of another attempt. There were, however, some aspects of the initial information of this case that showed positive protective factors. Her close relationship with her sister may be able to support her in gaining more support from the family, and that Claire presented to therapy at all is positive. One of the key ethical issues in this case is confidentiality and risk of harm. The client is indicating that she is thinking about suicide and has made prior suicide attempts. She has clear thoughts and plans about suicide and presents as viewing herself as alone in her experiences. Due to the disclosure of a suicide plan and the past attempt, an ethical issue of maintaining confidentiality or breaching the confidentiality in order to provide her with professional support that can lower the risk of self-harm. The APS Code of Ethics Standard A52 indicates that if there is an immediate and specific risk of harm to an identifiable person or persons that can only be averted by disclosing information, then psychologists are able to disclose. Another key ethical issue is competence in suicide. The client has presented to the psychologist for support with anxiety and depression, however, has revealed suicidal thoughts and actions. Due to her disclosure of a suicidal plan, the psychologist needs to consider the ethical issue of if they have the skill and competence to support the client in light of this new information. The APS Code of Ethics Standard B12 states that psychologists only provide psychological services within the bounds of their professional competence. The virtual client provided a form of interaction that simulated a real-life situation of being required to make ethical decisions under pressure and providing an experience of reflection in action. When engaging with the virtual client, it was easier to understand and assess the level of her risk and distress. Compared to reading the text-based history. With a large amount of social meaning being informed by non-verbal cues, interacting with the virtual client enabled a better and more realistic understanding of encountering ethical issues within the therapeutic environment. This interactive exercise has highlighted the complexity of ethical decision-making relating to breaking confidentiality due to concerns of risk of harm. During the exercise, due to the presentation of the virtual client and the additional information about her current lack of support network, a decision was made to break confidentiality and involve the CAT team. Although the client was concerned about her family discovering the extent of her current emotional state, it resulted in her family, particularly her mother, being able to demonstrate concern, which appeared to challenge the client's view of her role in the family. This has led to clear learning about the importance of ensuring appropriate and professional support for people at risk of harm. By engaging in this interactive exercise, it has highlighted the reality of encountering ethical decisions of professional competence. With 40% of suicide deaths having prior contact with a health professional, it is important for psychologists to be competent in this area. However, for a number of reasons, a psychologist may decide that they are currently not competent enough to support the clients appropriately. This exercise has shown key learning in assessing professional competence with the client's best interest as the main goal. Due to the break in confidentiality, there may be implications for the therapeutic relationship and the client's perception of trust. However, in the exercise with the virtual client, there was an indication that the client understood the need to break confidentiality to ensure safety. Another ethical implication is the possible need for the psychologist to continue to share confidential information with the CAT team. This would ideally only be done with the consent of the client. Finally, there are possible ethical implications regarding the client's family. Now that they have been made aware of her situation, the psychologist could encounter future issues such as the family members requesting confidential information. All ethical decisions and dilemmas inform future clinical practice. These situations enable all health professionals to reflect, learn, and develop how they approach future decisions. In this case, future clinical practice implications would be related to ensuring clear client understanding of the limitations of confidentiality and the psychologist's current practice when supporting clients at risk of harm. The psychologist may also reflect on their current professional support networks and provide and possibly widen the supports they can offer clients when their competencies cannot fully support the client's